talking about more of the sort of hand bones, et cetera, but also kind of moving on, different topic. I've seen some sort of crazy stuff you're doing now with, as we know, as we get older, or people do a lot of pinch grip, you get some arthritis in sort of the base of your thumb. We call it CMC. And you're doing some things now. We used to see remove it, put extensor tendons in there, and I think you probably still do that. But there's some other ways you basically are doing the similar stuff that I'm doing in the knee, sort of cartilage restoration, and other options for people that are younger, because those procedures aren't really as good. The other older procedures aren't really as good for young patients. So what are you doing that's sort of more innovative in that area? And are you doing arthroscopy? Are you have any other implants you're using? Tell us about that.
Yeah, it's a great question. It's a big interest of mine in terms of solving this problem of base of the thumb joint arthritis, and traditionally the operation of choice was to remove the arthritic bone called the trapezium, and then put in a spacer, typically a portion of one of the forearm flexor tendons or one of the thumb extensor tendons. And this operation works really well if you're 70 years old. But in somebody who's maybe in their mid 40s or 50s, who has kind of early onset of this problem, it's been a big problem for us to solve in terms of, well, what do we do for these folks? And like I mentioned, with the internal brace, that we sort of stole the idea from the foot and ankle docs. For base of the thumb arthritis, we're sort of borrowing from our knee colleagues in terms of techniques like arthroscopy. So now we can do, now that the cameras and the instruments from the knees have been miniaturized, we can now work in the smaller joints in the wrist and the hand. And so arthroscopic surgery at the base of the thumb is something that I enjoy doing. And oftentimes in young folks, this is my first step in terms of treating this issue. We can debride different cartilage lesions, and we can debride any inflammatory tissue that's in the joint, and hopefully buy folks a significant amount of time before having to do any major operations. And then kind of next up the line from our surgery is surgery to try and basically put a spacer in between the two bones, the trapezium and the thumb metacarpal. And by doing that, oftentimes we can preserve the normal anatomy. There's a reason why that trapezium and that thumb metacarpal are there to begin with. And so trying to keep them there for as long as possible just makes intuitive sense to me. And so we have different implants that we're now using that work as spacers. And then once we go beyond that, there's also a lot of interest in a technique that we're using called the tightrope technique, where instead of having to sacrifice some of the tendons of the forearm to recreate some of the ligaments that are required for thumb stability, we'll use a tightrope implant. And again, that's something that's been miniaturized and kind of stolen from our foot and ankle colleagues. So there's a lot of new surgical procedures that we're performing now that I think really will be incredibly beneficial to my younger patients, where we don't see that the traditional surgery that we do for a 70-year-old is going to hold up in an active 40 or 50-year-old.
I think that's a great comment. I think it's important for listeners to hear this, because I think, as Dr. Weil knows, I do a lot of the knee stuff, and I get a lot of patients, even in their 50s, that come in and they were only told the only options are replacement, right? Or the only option is this sort of extensor tendon salami technique that's really for 70-year-olds,
Right.
And so it's important for the patients to know that there's other options out there, and these are innovative. They're still cutting edge. We don't have 20 years of data on them, but they work really well. Things I did a couple surgeries today that they're only about a couple of years old, but nonetheless, they work very well. And so it's important to understand that those techniques are offered, and the second opinion is very important. So if you've seen somebody and you're not exactly sure, get another opinion. Always good to get another opinion, especially when you're younger and you don't want to have an end stage procedure. Once you get that trapezium removed, there's no going back, right?
Yeah.
So
yeah.
It's important to have those options.
And that's one of the things that I think is really important in our younger patients is trying to find solutions that fit younger active patients. An operation that's really good for a 70 or 80-year-old is not necessarily good for a 30-year-old. And really what we're trying to do here is tailor our treatment to the individual patient. And again, a 30-year-old is not an 80-year-old. And so we got to have techniques that we can use for our young active patients.